Hey guys, it's Pastor Inger here at Speaking Spirit Ministries, and I want to thank you for taking the time to watch this session from our 2021 Health Fair. Guess what? We have some really good information in this session. We have Dr. Abayomi. She is a dentist, and she's going to be talking about and dealing with our oral health and how our oral health, taking care of our teeth, is so critical and is linked to other health conditions that we can have in our bodies. So guess what? Get out your pad, your pens, get out your tablets, your phone, whatever you use to take notes, because we want to make sure that we're taking care of our body, but our mouth is a part of our body. So guess what? She's going to give some great tips, and guess what? You're going to have a better oral hygiene because of the things you apply from this session. So let's dive in and hear what she has to say about taking care of our teeth.
Thank you for having me do this presentation. It's been a pleasure trying to work on this slide for you guys. Hopefully I'll be able to share some useful information, and you'll be able to figure out that, you know, the oral health is really an important part as far as the whole body health. Let me tell you a little bit about myself. I graduated from the University of Texas at Arlington with my bachelor's in biology degree in 1999, and graduated from Baylor College of Dentistry in 2004, where I obtained my bachelor's of dental surgery degree. And I've been practicing for 60 years in Mansfield, Texas, with my partner, Dr. Maudro. She would not be on this session, but I'll be giving you all the information. So it's important to realize that the mouth is important as a whole body. A lot of people usually neglect going to the dentist. They wait till they have pain. And usually by the time you wait till you have pain, it's almost like too late. So we want to make sure we're encouraging patients to form a routine as far as making sure they're going to their dentist on a regular basis. Inflammation is the body's natural way of responding to fighting against infections, injuries, or toxins. So, you know, chronic inflammation is when the body's response lingers over time, and this response over a period of time can cause a negative impact on our bodies and our tissues over time. Inflammation plays an important role in chronic diseases that appear all over the body. Now, the mouth is the pathway to the body. Almost everything that enters through the body goes through the mouth. You know, if you have to take medication, if we're eating, the nutrition that we get into our bodies goes through the mouth. So it's very important that we realize the correlation between our overall health and, you know, the quality of life and the interaction or the role the mouth plays with whole body health. I'm going to talk a little bit about bacteria. The oral cavity is colonized by a variety of bacteria, viruses, fungi, and protozoas. So, you know, the mouth can really be a breathing ground for bacteria. We all have some level of bacteria in our mouths. A patient's level of hygiene will typically have some impact in the level and makeup of bacteria present in the mouth. So you could have a patient that, or someone that has a good hygiene, they would have simple and low levels of bacteria. And if you have someone that has a poor hygiene, they would have more complex and higher levels of bacteria. And when you have more complex, higher levels of bacteria, you would have more destruction in the mouth, and we would see more destruction in the structures and the teeth in the mouth. Bacteria found in the mouth have also been associated with cardiovascular disease, bacterial pneumonia, low birth weight, diabetes, and recently, there's been some link, the same bacteria having some association with Alzheimer's. Now, me saying there's an association doesn't necessarily mean there's a causation. So you could have cases where, just because you have certain bacteria doesn't mean it causes cardiovascular disease. There's just a link that they are still doing research on. Oral health is important, and having a good, healthy oral environment is important enough to where, we find that patients that have, heart defects, sometimes their cardiologists will usually recommend that they take antibiotic before getting any major dental work done. We also find that patients that have orthopedic surgery done, sometimes within the initial years of their surgery, they usually recommend that antibiotics be taken before a dental procedure is done. So I believe all these other medical fields will not be recommending antibiotics to be taken if they do not see a link between the oral health and the whole body health. Now, I'm going to talk about periodontal disease. Other than cavities, periodontal disease is one of the ways where patients end up losing their teeth. A common trait, periodontal infection and cardiovascular disease, diabetes, a common trait that they have is they're all chronic conditions, and it takes a period of time to develop to develop the infection and for it to become clinically significant. So a chronic immune inflammatory disease caused by bacteria, periodontal disease, is when you have the bacteria that causes destruction in the supporting structures in the mouth. So we're talking about the gums and the bones that support the teeth. Gingivitis and periodontitis is a spectrum of disease, of periodontal disease. So you have the early stages, which is gingivitis, which is reversible. And you have the, periodontitis, which goes from mild to could end up to be a more severe disease. For this to be an issue, you would need a host. You would definitely need bacteria. But what we are finding out is your immune response definitely plays a significant role in how the disease progresses. So for instance, we could have a patient that has the same bacteria in their mouth, and if their immune system is good, their body is able to fight the infection to where they do not see significant amount of bone loss over time. But if your immune system is low, the disease will progress really fast to where you would notice destruction in the supporting structures, the bone and the tissue over time. Now, I'm going to show you a slide here of what a healthy oral cavity looks like. Healthy oral cavity is characterized by a pink. This is what dentists love to see. A nice pink tissue around the teeth. It's firm. There's no redness, no swelling. The tissue kind of follows the outline of the neck of the teeth. Perfect. So I'm going to start by showing you what a healthy oral cavity looks like. We love to see nice pink firm tissue, no redness, no swelling. And the gum kind of follows the outline of the crowns of the necks of the teeth. Also, we could have presentation. This is person, depending on your ethnicity, You could have dark pigmentation, dark pigmented gum tissue. This is also considered normal. We love to see the tissue nice and firm on the teeth, and no swelling, no puffiness, and no bleeding. If you were to brush your teeth and you start noticing bleeding, that would technically indicate that, you know, there's something wrong. So when patients come to my office, what we like to do is screen patients to see if they have periodontal disease. We have a periodontal probe. You can see the instrument right here, and it has markings on it showing where we can measure. Each line there is about 3 millimeters. So we would have 3 millimeters, 6 millimeters, 9 millimeters, and 12 millimeters. And usually we do this screening on patients 18 and over, just to see how healthy their gum tissue is. What we do is we measure. This is a model showing, you know, the teeth, the gum, and right here, can you guys see the pointer on the screen? I'm not sure if you can see the pointer right there, but here you would have the gum tissue, and then under the gum tissue is where the bone is. So for patients that come in the office, we would usually do screening, usually 18 and older, to see if there's any indication of gum disease. So what we would do is kind of measure. Each tooth has 6 points on there that we would check, and we would try to measure where the gum tissue is to where the bone level is. Ideally, what we would like to see is, you know, 3 millimeters and below. Anything greater than that can indicate maybe inflammation or bone loss. So in this model here, you can kind of see where that probe is. The probe is probably 3, 6, you know, probably maybe 11 millimeters, and you can see the dip in the bone right there. So that is indicating that that patient is having some issues with the bone. I'm going to show you a diagram here. Again, what we would do is kind of measure where the gum tissue is, and this is a side view of what we would like to see on our patients. So where the gum tissue is to where the bone level, ideally we would want to see 3 millimeters or so. When we check and we start noticing anything greater than 3 millimeters, we could have mild periodontitis, which is 3 millimeters to 5 millimeters, moderate periodontitis, which is 5 millimeters to 7 millimeters, and severe, which is probably 7 or greater. And usually what causes this is over time, patients will have accumulation of plaque on their teeth. Bacteria produces plaque, and if that plaque is not removed over time, it attaches to the teeth. Now, plaque can easily be removed by us brushing our teeth diligently, and if that plaque is not removed, it kind of hardens and calcifies on the teeth, and then it migrates apically down the root of the teeth. This is an irritant to the teeth and the supporting gums and the bones, and the gums and the bone gradually over time kind of move away from the teeth. So for instance, here on the upper right screen, you can see us measuring this patient, and this is healthy. You don't notice any bleeding in the gums, and the probe usually doesn't travel far into the tissue. This is considered healthy. On the x-ray on the bottom right, where that red line, that's what we like to see where the bone level is on the teeth. So on the left side here, we have a patient, even though, you know, you can see the gum line is kind of like around the neck of the teeth. This can be very deceiving if we didn't have x-rays or if we didn't probe the patient. You can see right there with the probe, it's almost the whole length of the instrument went down the gum tissue, that is indicating that that patient has bone loss. So in this diagram on the x-ray on the lower left side, the green line indicates where the normal bone level should be. But what we find in patients like this is the bone level has kind of receded and kind of moved apically. They've moved down the root of the tooth. And this is usually a problem because once you've lost bone support for the teeth, we usually can't get it back. What we can do is just maintain that bone level. There's some advanced procedures, bone grafting, that might be done, but they don't usually offer a good degree of success depending on how severe that bone level is. So I like to tell my patients, you know, the bone is the foundation of the teeth. It's what holds the teeth in place. So once you start losing the bone, you can start noticing, you know, your teeth shifting, drifting of the teeth. And, you know, that's usually not a good sign. So we usually try to encourage patients to make sure that they're going on a regular basis to have their teeth checked at least once, you know, a year, twice a year, if you have good, healthy teeth. Sometimes for some patients, they require more care, and we usually would recommend sometimes 3 or 4 times a year, depending on what conditions that we are trying to treat. Now, here is a patient. Let me reduce this screen just a little bit. Here's a patient here that has gingivitis. Gingivitis is a reversible form of gum disease. It's usually caused by bacteria. You can see on the upper screen here, bacteria, the plaque has built up around the teeth. The gums are unhealthy. You can tell they are red around the gum line. And if a patient like this try to brush a little bit aggressive to remove the plaque, they would notice bleeding of the gums. Gingivitis is considered like an early stage of periodontal disease. It causes inflammation of the gums. You can see right here on the lower screen how the gums are red in comparison to the previous slide that I showed at the beginning of how a healthy gum tissue is. This is considered unhealthy, and it's caused by accumulation of plaque, by the byproduct of bacteria over in the mouth over a period of time. Patients will notice swollen gums, red gums, bleeding maybe when they're flossing or brushing their teeth. Now, gingivitis is reversible. So, you know, it's reversible when, you know, patients, you go to the dental office, they get a professional cleaning done, and, you know, the patient has to do their own part as well to make sure that they are cleaning their teeth at home, brushing and flossing really well on a daily basis. Now, when gingivitis is uncontrolled and it's not taken care of, it progresses to a more severe disease, gum disease, periodontitis, and it could go from mild to a severe form. It's progression over time, and it causes significant damage to the gums as well as the bone support of the teeth. On the slide on the top, the picture on the top here, you can see the buildup of the plaque that is hardened on the teeth. This has to be removed by professional care. You would see and notice the gums are inflamed, swollen. If you would try to touch this tissue, it would cause a lot of bleeding. On the bottom here, you can see this is a more advanced stage of periodontitis, and it's severe to where the patient has lost several teeth. We would usually notice, the teeth kind of moving within the socket without, and that's usually an indication that, there is significant amount of bone loss. So what happens as far as gum disease is you have bacteria, like I said earlier, and plaque accumulate and pool in the pockets of the teeth. Ideally, I mentioned to you that we would like to see maybe a 3 millimeter pocket or less. That is because when you brush your teeth, on a regular basis, 3 millimeters is just enough to where if you brush your teeth, that pocket is easily cleaned by, the toothbrush and the water in the mouth. So if you were to get pockets that are higher than 3 millimeters, you would just have bacteria pooling under the gums for a long period of time. And that pooling of bacteria over a period of time in a dark area where, they're not easily clean, causes that bacteria to really, gives it an environment to grow and populate to where they cause significant amount of problems. Now, the treatment, what we would usually do with patients is we would do what we call a scaling and root planing, and I'll show you an image of what that looks like. Sometimes we might use antibiotics to help treat some of the infection. It could be most times localized antibiotics placed into the pocket to try to kill some of the bacteria. And sometimes surgery is even needed in some of these cases to make sure we get the patients back to health. Usually, patients are seen on a regular basis. We usually recommend every 3 months. So that way we can monitor their gum health to make sure, the bacteria is not causing destruction before we're able to halt it. So 3 months is usually the timeline where bacteria seems to cause significant amount of damage. So we usually recommend patients come in every 3 months. So if there's any bacteria in their mouth, we're able to remove them and the tartar, remove those before they start causing damage to the supporting structures of the teeth. Here on the left side, on this slide, scaling and root planing is when we mechanically remove the tartar that's attached to the teeth, be it plaque or calculus or tartar. We would scrape that off. And root planing is kind of smoothing the root surface of the teeth so that way the gum tissue can reattach back to the tooth. If the gum tissue reattaches back into the tooth, then the bacteria really does not have any room to go into those pockets to cause destruction. Here is an X-ray of what tartar buildup looks like on the teeth. And here's, sorry, I'm about to sneeze. Okay, never happens when you need it. Excuse me. All right, so here is tartar built up on the teeth, and the slide image on the right side shows when it is cleaned off. So if you have tartar built up, and this is probably years and months of accumulation, depending on how this patient's oral hygiene is, you could have that buildup be so heavy to where patients cannot feel the individual teeth. So what we will do is mechanically remove, the tartar built up. And you can see on the right side by the time we're done, and the tissue right here is still, you can tell how inflamed that tissue is once we have removed that tartar. Now, this tissue over time is going to heal to where it's nice, pink, and firm. But patients should be able to feel with their tongue each individual tooth in the mouth after the cleaning. Here is another view. Right here on the left side is, a patient before the cleaning, and on the right side after the cleaning. You can see on the left side on the bottom teeth here where that tartar has kind of attached to the teeth, and the migration of that tartar on the teeth into the roots of the teeth have caused the gum tissue to recede. So after the cleaning, you can see the gum tissue that needs to be on a higher level has kind of gone down to the roots, and you have roots of the teeth exposed due to the bone loss and the migration of the tissue, patient's tissue down the roots of the teeth. Now, as far as, patients with periodontal disease, we have to make sure that you have meticulous home care. Some dentists might tell you brush for 2 minutes, but I really say brush until your teeth are clean. Some patients need to pay more attention to their teeth than others. It's almost like, we all have different genes, and some people are blessed with, teeth that they don't need to do a lot of work with it, and some of us, we just need the extra work to make sure our teeth are clean. So we just need to throw everything we have at it. We need to brush more, maybe twice a day, maybe 3 times a day, even, add in maybe brushing in between meals and flossing. When some people can get away with, brushing just once time a day, some people really have to work at it, and they have to brush maybe 2-3 times a day. Some patients can get away with going to the dentist maybe once a year. Some patients, we would love to see them more often, 4 times a year or even more, depending on what their needs are. So we all come with different, dental needs, and, we cannot compare patients. So, everybody kind of has to follow what they need and what the recommendations are. Now, patients that have periodontal disease, if this is a condition, we would usually have to follow the patient over a period of time, most of the time over the patient's lifespan. Sometimes the patients might need to be seen every 3 months. And sometimes, some patients, it could be every 2 years. It just depends on how much control the patient is able to get over their periodontal health with their home care. Some patients really do a good job to where they've figured out what kind of regimen works for them. So we can get away with seeing some patients twice a year. But if a patient doesn't have enough tools to do a good job by themselves at home, I would usually recommend that those patients be seen probably, 3-4 times a year. Most of the time, insurance does not cover all the necessary treatments. So there might be a little bit more out-of-pocket expense for patients. Diabetic patients are one that, we recommend if you do not have your, blood sugar levels under control. What we usually find is healing usually takes longer, or it's usually a challenge in those patients. Just as with, the body, if a patient with diabetic that has blood sugar level would have difficulty with healing, we see the same thing in the mouth. So you could have a patient that it's very difficult to get their periodontal health under control if their blood sugar levels is not under control. So it's important, that if you're diabetic, you make sure that you're checking your blood sugar levels and you're keeping that under control. Otherwise, if you have periodontal disease, that can progress to get worse. One thing that I'm going to talk about, I have a few minutes here, is, the effects of some of the medications that we take on the oral cavity. We have one of the most common things that we notice with especially seniors that are on a lot of medications is they have dry mouth. This is, symptoms are, the patients would have sticky, dry feeling in the mouth. They would usually have frequent thirst, sores in their mouth, cracked lips, dry feeling in their throat, tingling sensation in their mouth, or they would have red tongue or difficulties speaking or swallowing. And, sometimes there are just so many medications that causes dry mouth. And sometimes for some patients, these medications cannot be changed. They are essential as far as keeping health. So what we usually recommend is that patients hydrate with a lot of water. They should avoid carbonated drinks, alcohol, tobacco, or caffeine. Anything really that has sugar is very harmful, because once you have dry mouth, you are also prone to having cavities. So you have to make sure you hydrate the tea to where you don't have bacteria sticking on them. We also recommend ice chips throughout the day. Some patients kind of like the crushed ice, maybe from Sonic. I'm not talking about the hard ice that you have to that have the potential to break your teeth, but the crushed soft ice that you find at maybe Sonic. We also recommend some over-the-counter products. Biotene is a good brand that they make products that are used for dry mouth that can help with patients that have, they can help with kind of hydrating and maybe stimulating saliva flow. Some patients, if it's really severe, we could even get to a point where maybe their primary care physician can recommend some medication that could help stimulate their saliva flow. So right here on the image, you can see the tongue of a patient that has dry mouth. They've lost all the taste buds on the surface. It's kind of bright red. You have dryness at the corner of the lips here. And it's usually hard for these patients. They're constantly they have difficulty talking, and sometimes they have, just a hard time swallowing, to where they have to take frequent breaks before they're able to speak. So what we don't want is, sodas or energy drinks. You want to hydrate with water. Whatever you could use, some over-the-counter products to help with saliva flow. Make sure it doesn't have sugar. It has xylitol, which is a sugar-free product. Sugars would usually cause cavities, which would be another problem that we do not want to deal with. And, there are mouth rinses that would help balance the pH in the mouth, and, toothpaste and products that would help prevent cavities as well. Some patients, depending on medications they use in the mouth, we notice some infections in their mouth. Here is a patient. I had a patient once that he came into the office and he had like white lesions on the roof of his mouth. And he was an asthmatic patient, and he had an inhaler that he would use on a daily basis. And inhaler is kind of like a steroid. So what he presented with was, fungi infection, kind of like a thrush at the back of his throat. And the way we treated that was, with antifungal rinses. Sometimes we have the same thing appearing at the corner of the mouth, where patients kind of have cracked lips that's not healing over time. Some of that is fungal infection. We can treat that with ointments in the mouth. Here's a patient that has a partial, an appliance for replacement of teeth. Maybe they are not removing their appliances at night, and this causes some irritation and burning on the roof of the mouth. So these images here are fungal infections that we notice in the mouth. And, with patients, we recommend, fungal rinses, sometimes topical to be placed on the surface. You really want to pay attention to what's in the mouth, what's going on in the mouth. Some patients have ulcers that might develop over time. Some might be viral in nature. Some might be due to deficiency in vitamins, and those can be treated with topical anesthetics. Some of these ulcers can also be viral in nature. And usually what I tell patients is if you have any ulcer or any trauma to injury to the mouth, usually this area should heal in about 2 weeks. If it doesn't heal in about 2 weeks, you definitely want to bring it to the attention of your dentist. And I'm going to share a slide here. One thing as a dentist that we usually try to stress with patients, at least my patients, we really need to be aware of what is going on in our mouth. If you have sores in your mouth that's not healing, maybe within 2 weeks, you really want to bring it to the attention of your dentist. Sometimes it might be necessary for us to do biopsy in the mouth to make sure none of the lesions are not cancerous. So we really need to pay attention to like ulcers or sore spots that are not healing, bumps, blisters. They could present themselves as white lesions or red lesions or ulcerated lesions. Even on the patient on the right side here, on the lip, it could be like a dry, crusty presentation. Sometimes that could be oral cancer if it presents for over 2 weeks and it's not healing, or something that looks like it's changing over time and not healing. Make sure to bring it to the attention and have someone take a look at it. Sometimes we would refer to a specialist like an oral surgeon, even an ENT, where they can do a biopsy and provide some kind of diagnosis for those lesions. I'm running out of time here, so let me go. As far as recommendations, what I would recommend is, we only have, as adults, one set of teeth when you've lost your baby teeth. So we should just try to take care of what God has given us. And if you find yourself in a situation where, you have problems with your teeth, some patients, I try to tell my patients that some patients need to do more work than others. It's almost like if you had diabetes and you have to pay close attention to what you eat. You can't go eating what everybody else is eating. The same way with oral health, if you know you have problems with your teeth or your gums, you would have to pay more attention and do more work than other people when it comes to your gum and the health of your teeth. So my recommendation is to find a good dental home, find a good dentist that you feel comfortable with, and they know your oral health, and if there's any changes that's going on, they'll be able to direct you and provide you with the necessary treatment that you need. The other thing is, don't wait till it hurts. A lot of time with medical conditions, early diagnosis is key. So that's why we recommend patients to be seen on a regular basis. That way, if there's anything going on, we can really catch it early before it gets worse. The other bad habit people have is we tend to self-diagnose. You don't want to be your own doctor diagnosing yourself. There's a reason why we have doctors, and there's a reason why they've gone to school for many years to get training. So let the specialists and let the doctors do their work. If you have any concerns, go to the doctor. Try not to Google things, because once you get on, the internet, you tend to find too much information, some of them which might not pertain to you. And some patients get scared and decide, they'll rather just not deal with it. Try to find a good dental home that you're comfortable with and a doctor, and, don't self-diagnose. Try to form a habit to where you're going on a regular basis so other people can check the health of your teeth. The other thing is, look, just in case you have any lesions in your mouth, you're the one that knows what's going on in your mouth best. So if you have any lesions or anything that you have concerns about that's not healing within 2 weeks, at least 2 weeks, you definitely want to bring it to the attention of your dentist. And most importantly, brush at least twice a day and floss, floss, floss. I tell my patients, sometimes we can tell in the office a patient that brushes really well, and if they're not flossing, we can really tell. And this is what I like to tell my patients. Your toothbrush really does not get in between your teeth. So if you're not flossing, there's really no way of getting rid of the plaque in between your teeth. And really, when patients have gum disease issues, and they can have gum disease issue that's isolated in between the teeth if they are not flossing. So flossing really helps get rid of the plaque in between the teeth. So you really want to get into a routine of brushing at least twice a day, in the morning and at night, and flossing. Flossing for some patients usually start out being difficult, but once you get into the habit, it really becomes much easier to where you don't struggle doing it. So hopefully I was able to provide you guys with some good information, and hopefully, you're able to see that, oral health is really important as far as overall body health. Everything that goes through our body goes through the mouth, and the bacteria in our bodies have been linked and found in other areas of the body to cause harm as well. So thank you so much for having me in for this presentation. I don't know if anybody has questions. Let me see.
Dr. Abayomi, we have 3 questions for you.
Okay.
One of our first questions was, what's the best toothpaste and mouthwash to use?
Oh, very good question. And there are several different toothpaste on there. I usually recommend my patients use toothpaste that has fluoride in there. Fluoride is good as far as preventing cavities. As far as mouthwash, I really don't. It just depends on patient's preference. Some are alcohol-based and some others are not. Sometimes you just have to see what works best for you. There are some toothpaste out there that, especially the whitening toothpaste, they tend to cause sensitivity on some patients. So if you have sensitive teeth, you probably want to stay away from whitening toothpaste that might cause sensitivity. Another question I can see on there, when you lose enamel, can you get it back? No, once you lose the tooth enamel, which is the strongest part of the teeth, the outer layer of the teeth, you can't get it back. The best way to get rid of sensitivity would be to use a sensitive toothpaste. You have over-the-counter sensitivity toothpaste like Sensodyne. That really helps a lot, but a lot of times patients would usually have to stay on those sensitivity toothpaste for over a period of time. If you find that Sensodyne or one of the over-the-counter medication is not working for you, there are prescription-based sensitivity toothpaste that you can get from your dentist that can help you. Another question here, do you recommend using a Waterpik flosser if you have trouble flossing your teeth? That's another question that's good. Waterpik flosser, it's good. It helps as far as irrigating the pockets of your teeth. But I still recommend flossing. The string floss, it's still my preference. Waterpik helps as far as flushes the bacteria in there, but you still have to mechanically use a string floss. You can use those floss picks and kind of get in between the teeth as well. The Waterpik flosser is good for patients that maybe have gaps between their teeth, or they have maybe bridges or dental crowns that they need to get under to clean pretty good with. Is the toothpick the same as using a dental floss? Toothpicks. I usually don't recommend toothpicks. The reason is because with toothpicks, you tend to dig into the gums, and a lot of patients usually end up causing a lot of damage to the gum tissue, almost creating, like a space between the teeth if you're using a toothpick over time. I usually recommend patients, if they have a problem as far as if they're not getting the floss to get food out, what you can do is tie a knot in the floss and kind of pass it through, and that would usually help get things out. If you need help as far as getting food debris, maybe a floss, a Waterpik can help with that as well. And the Waterpiks usually have some kind of tips at the end that can help to where you're able to irrigate deeper. What's the best toothbrush to use? Electric or manual? It depends. If a patient has limited dexterity to where they're not really able to use their hand properly, electric toothbrush would work very good. Manual toothbrushes are also good as well. My main recommendation is just to make sure that your toothbrush reaches all the surfaces of your teeth, and check in afterwards to make sure that your teeth are clean. I usually tell my patients to rub their tongue, try to rub their tongue on their teeth. And if you're noticing that any areas that are still having a rough feeling on there, you probably need to go back and touch up on those places. So electric or manual, either one, it really depends on the patient and what really works best for them. But I strongly recommend patients stick to a soft bristle brush. Anything other than soft would cause damage to your teeth. So don't even try getting a medium bristle or hard bristle brush. Those will cause damage to your teeth. My practice is located in Mansfield, Texas. I'm new in Richmond area. Any recommendations? Well, I don't live in Richmond, so I'm not familiar with dentists in that area, but my recommendation is, just ask people. The best way is to ask people about, ask people for recommendations to the dentist that they're going. And if they feel comfortable with their dentist and they've been going there for a couple of years, that's a good sign that maybe they're receiving good care. So you might have to try it out to see what works best for you.